welcome Dr. Jodie Bailie and Associate Professor Michelle Villeneuve to make this presentation today on exposure to risk and experiences of river flooding for people with disability and carers in the Northern Rivers of New South Wales. So I'll hand over to you, Jodie, but first I need to stop my sharing. Has that stopped? Jodie, you're on mute.
I'm just doing the screen share.
Okay, I'm
at
off.
the moment.
Great.
And then down the bottom. There's a new share. And then down the bottom. Where's the other? I need to swap the view here. Sorry, everyone. This is always quite a challenge for me for some reason. I think, are you sharing? Can everyone see that?
I can see your screen, Jodie, with the title slide.
Oh, great. Fantastic. Yay. Thanks, everyone. And thanks, Megan, for that introduction. And I too would like to acknowledge the Widjabul people of the Bundjalung Nation who have protected and nourished this land for millennia. So I'm meeting today on the lands of the Widjabul people. Delighted to see so many people here today. Thank you. We've got a great range of people here from a variety of backgrounds from what I can gather. And so thank you for coming. My name's Jodie Bailie and I'm a Lismore-based research fellow at the University of Sydney's Centre for Rural Health. And at the UCRH, we do work very hard to research, I guess, very locally relevant topics. And we try and do this through community and academic partnerships. And really the presentation that I want to do today is the outcome of a fantastic community and academic partnership that occurred after the 2017 floods. So it was a study after the 6 months afterwards in the Northern Rivers. And clearly the implications from the 2017 data that we collected has implications for the recovery efforts for 2022. And then Michelle, which is fantastic to have Michelle here today, she'll then share with us some tools that multiple stakeholders can use to address the gaps in preparedness for people with disability and carers. So I guess I just wanted to start by just pointing out the take-home messages from this presentation. And so the take-home messages really are that people with disability and carers are disproportionately impacted by events such as flooding. We know from our study that people with disability and carers were more likely to be flooded, evacuated, and still be displaced 6 months after the flood. And also have more likely to be distressed and have probable post-traumatic stress disorder. So the other take-home message is around longer-term investments and tailored supports required, possibly for years afterwards. So this is not something that's a couple of months. And more purposeful inclusion in flood preparedness and recovery efforts is required. And clearly there's a scope for, and particular need for further research into the impacts and experiences of people with disability and carers in such events. So, I'm not quite sure if my slide's going across. There you go. So we know that the severity and frequency of river floods is likely to increase as the result of as the climate warms. And flooding has been linked to increased prevalence of mental health disorders such as post-traumatic stress disorder, anxiety and depression. Floods really do expose and exacerbate existing social inequalities. And importantly, floods intersect with the social, cultural and economic factors to shape a person's exposure to risk, their ability to prepare for, respond to and recover from events such as flooding. And so for people with disability, it's their social and personal factors that interact, and it's these circumstances that render them more vulnerable in emergencies. So concerns have been raised in research and media that people with disability are being overlooked or left behind in emergencies such as flooding. And these voices have been heard, and the Disability Royal Commission in 2020 documented this disproportionate impact. But despite this, little is known about the experiences and mental health impacts of river flooding for people with disability and carers. And so research has really lagged behind, and this is partly because people with disability haven't been front of mind in research. And so we've therefore set out to address this gap. So the study was located in the Northern Rivers region of New South Wales in 6 local government areas, and again 6 months after the 2017 floods. The region in the Northern Rivers is known as a hotspot for weather-related extreme events, such as particularly flooding, which probably comes as no surprise, no new news for anyone here. Within this region, there is a higher proportion of people with disability and carers compared to the rest of New South Wales, and also high levels of socioeconomic disadvantage within some of these LGAs. And so some of these LGAs are actually in the top 10% most disadvantaged in the state. So the entire study was really driven by a community and academic partnership that was led by the University Centre for Rural Health. And the data draws on a cross-sectional survey that was undertaken between September and November of 2017. Community members who were 16 years and older were invited to take part of in the survey. And importantly, we really worked hard to recruit participants from a broad cross-section of the community with a diverse range of socioeconomic backgrounds, and also people who had different levels of flood exposure. So mental health status was assessed using brief versions of validated screening tools, and also there were a number of free text opportunities in the survey for people to complete. So we had just over 2,200 respondents, and of that, 164 people identified as having a disability and 91 were carers. And so the reference group for our analysis was others. So after flooding, people with disability had more than twice the odds of having their home flooded and to be evacuated. Close to 4 times the odds of experiencing disrupted access to food, support networks, essentials such as healthcare and social services. And carers had over twice the odds of experiencing disruption to services. This figure is quite shocking. People with disability had close to 4 times the odds of still being displaced 6 months after the flood. The data here on the mental health outcomes have been adjusted for socioeconomic variables and severity of flood exposure. And what it shows you is that people with disability had 3 times the odds of probable post-traumatic stress disorder, carers nearly twice the odds, and people with disability were nearly twice the odds of still being distressed about the flood 6 months afterwards. So So with some of the qualitative comments, we analysed the qualitative data, and we found that there were challenges with information related to evacuation orders and flood warning systems. So for example, some people reported not being able to hear the warning signs, or at times not being able to, the messages weren't being delivered in a way that they could understand. And so people really struggled to be able to be given the information to be able to make effective decisions. There were numerous reports of people evacuating late or not at all. People with disability and carers reported taking longer to evacuate due to a lack of transport, extra time required for packing and moving equipment, and sensory challenges and disruptions to routines. These communication barriers affect how people become aware of the extent of the flooding, the need to evacuate, access to emergency information during the flood event, and also their ability to seek assistance. And this quote here really speaks to that. So I didn't know what evacuation meant, what to take, would I have to stay there, where to go? I had no idea what river levels meant. And another quote, when we did evacuate, it was late because we were worried about our children, one who is autistic and easily stressed when routines are disrupted. Housing vulnerabilities likewise were evident. And there was a lack of affordable accommodation for displaced people. And when you go back and you think about that figure that I put before about people with disability being at 4 times the odds of still being displaced 6 months after the flood, the housing vulnerability becomes quite poignant. So this really resulted in people living in unsafe accommodation, so with mould, no cooking facilities, or properties with major structural damage, or having to relocate to other areas. And with that comes a subsequent loss of support networks, or even becoming homeless. Following a disaster, people with disability, they have to navigate 2 very complex systems or bureaucracies. So on one hand, you've got the emergency response and recovery arrangements, and then on the other hand, you have the disability services. And so people need to navigate both of these complex bureaucracies. And more than likely, the disability services themselves have been compromised by the same disaster. And this quote here really speaks to that theme of disrupted networks. So one of my son's carers, he has severe autism and always needs one-on-one attention, was flooded out of her home. She's going to be leaving the area. It greatly affects us, and particularly my son. The major disruptions to support networks. So of course, with any study, there's strengths and limitations. A particular strength of our study was the community and academic partnership, and something that I'm very proud to have been a part of. And we use local community and organisational networks to recruit respondents by personal and local organisational networks. And I'm quite sure that there are a number of people online today that were intimately involved in this study. It's important to note, though, that our sampling approach, though really necessary to meet the aims of this project, constrains our ability to generalise our findings to the broader population. And importantly, though the survey was available in several formats, clearly the survey may have been inaccessible for some people. So there are some important things to consider. So the implications. So there is a clear need for targeted and early warnings so that people can take action to keep safe. A dire need for alternative, short and long-term accommodation. And this is the implications from the 2017 floods. For now, we can only imagine the need. People with disability will take longer to recover. They need longer term supports, and as I mentioned before, possibly for years. The vulnerability of people with disabilities further increased as they are not included generally in community level disaster preparedness. Our findings clearly support recommendations for an increased focus on disaster preparedness, which includes people with disability and carers, who are supported to learn about their own flood risk and what to do in an evacuation. And that's why it's so great today we have Michelle here to help us, to guide us through some tools that are available in that area. And also just finally, given that the disproportionate impacts that carers experience, it's important that they also are identified as a key interest group. The two catastrophic floods, one at the end of February and one at the end of March this year. The devastation in terms of housing, trauma, displacement is much worse than 2017. So the issues for people with disability and their carers raised here are far from resolved. The two reports that have just been released on the floods 2022 fail to mention people with disability or carers. No specific disability recommendations. One of the biggest barriers to the safety and well-being of people with disabilities is their exclusion from decision making. We perpetuate risk when we omit consideration of their support needs in any post-disaster recommendations and reviews. Responding effectively to the support needs of people with disability in emergencies means making sure that they are at the table. That was quite surprising. I was quite shocked to see that. Maybe I shouldn't be. We have, so I just wanted to put on the screen here, our work, though our work wasn't in the reports or recommendations, we did put some effort in. We have been it has been used to inform the Disability Royal Commission. We've written 2 articles for the conversation, and there's a journal article that we've published, and it's all open access. And more research is just urgently needed in this space. So just some acknowledgements. Clearly the respondents, the research team, funders, and also Media Mode and ABC for permission for the images. But one more slide. Just want to go back to the key messages. I guess so, I'm not going to read them because I've just been through it, but the severity and the frequency of flooding is likely to increase as the climate warms, and so too will the human impacts. We really urgently need to find ways to improve how we prepare and respond. Thank you. I'll just hand over to Michelle now. Michelle, I'll just stop sharing my screen.
Sure. Thanks so much, Jodie, for that overview. And hello to everyone. I'm calling in from the lands of the Gadigal people and the Wangal people of the Eora Nation. And I'd like to acknowledge any Aboriginal people who are joining us here today and pay my respects to elders past, present, and emerging. I'll share my screen and continue the conversation where Jodie left off. It's been an absolute delight to be able to work with Jodie and her colleagues at UCRH on that flood data, and to be able to contribute to that work around the inclusion of people with disability, particularly in the research that they were doing, which was quite visionary at the time. We know, and we've just heard evidence of this, but I would like to reinforce the disability stigma is actually the single biggest barrier to the health and well-being of people with disability when disasters strike. And what happens is people with disability become overlooked, excluded, and an afterthought in our disaster management planning processes and practices. So it's probably no surprise, although frustrating for us, to see that they're also not included when it comes to reviews in post-disaster inquiries as well. I'd like you to meet Peter and Christy, though. Peter is a disability advocate, and he's also a person-centered emergency preparedness peer leader. He has a person-centered emergency plan himself, and he enables preparedness in others through peer support and mentoring. And he's part of our teaching team, where we've scaled up training by people with disability for people with disability to have a tailored plan. Christy is works for her local council. And Christy's an emergency manager, and her local council in 2019 took on the challenge of increasing disability inclusive disaster risk reduction in their policies, practices, and particularly in their emergency management plans. And this was Peter and Christy's first meeting. Christy opened the conversation with Peter, and it went something like this. Peter, I know that you're really busy, and I don't want to, disturb you. I don't want to waste time of your peer support group. So I'm going to gather all of the information I can about disability inclusion. I'm going to go talk to Michelle and her research team who's doing this work in this space and the other council areas that are involved. And then I'll bring all that information back and come with some strategies and ideas for you and sort of run them by your peer support group. And Peter said, Christy, with all due respect, I'd like you to stop right there. You need to include us right from the beginning. You're not wasting my time, and you're not wasting the time of my colleagues. And with a giant dose of humility, this started an incredible relationship between Peter and Christy, which led to some, what Christy would say are not so significant changes to their emergency management planning and practices, but that were disability inclusive. And she says they weren't significant because they weren't actually hard to do, and they should have been doing them all along. In 2015, I'll take you back a little bit, 2015, disability inclusive disaster risk reduction was not a part of Australia's disaster management lexicon. It wasn't in the vocabulary. We had 4 principles: accessibility, collaboration, participation, and non-discrimination. But there were no tools for putting those principles into action. The how-to guide was missing. 6 years later, we're making a sustainable impact in this space. Not only do we have the tools, as you can see a number of them on the slide, and many more on our website, which I'll show you later, but we have the rule book and the requirements for action now. These rules are now embedded into Australia's disability strategy, the National Disability Insurance Scheme Quality and Safeguarding Commission legislated amendment, and the practice standards that accompany those changes. So how did we get from this big idea to legislated change in just 6 years? It really was through participatory methodologies that put people with disability at the center and their support needs in focus when thinking about how do we all need to mobilize what we can do and should do within our roles and responsibilities to decrease risk and increase safety and well-being for people with disability. We employed what we call the knowledge to action process, which we borrowed from the interprofessional collaboration literature and the integrated knowledge translation literature. And we overlaid an appreciative inquiry process. So what you see in the center is the combination and the synthesis of things that happen in order to co-produce tools that everyone can use. Apologies for the dog. And a knowledge to action cycle around the outside, where we look at identifying practices that are already working well, leveraging and amplifying those practices within communities. So DIDR really means making sure that people with disability have the same opportunities to access emergency preparedness information, to participate in emergency preparedness programs in their community, and to be included as a valuable stakeholder in local disaster risk reduction. And this is really important because people with disability have higher demands and fewer choices. And this is actually what increases their risk in a disaster. And if our emergency personnel are unaware of the increased risk and the limited options that people have, then they will not be able to respond effectively. Essentially, our emergency personnel need to understand what people with disability can do for themselves and what they need support for. And we need to build this through cross-sector collaborative action. And this really needs to happen at the local community level. It needs to be then supported by our regional, district level and state governments, and nationally, particularly when disasters overwhelm local communities. These need to be actions that are person-centered. Now, I just want to highlight that we actually have arrangements at an international level. In the UN Convention on the Rights of People with Disability, particularly Article 11, among others, and in the Sendai Framework for Disaster Risk Reduction, there is a call for people-centered approaches to disaster risk reduction. The Sendai Framework that was built on the UN Convention outlined accessibility, inclusion, and participation as key features within that framework. And I should note that it was the first time that disability was mentioned in any international disaster risk reduction framework. It was the result of a significant amount of policy advocacy that was happening, led by disabled people's organizations and their members. What I want you to pay attention to here is this call for people-centered approaches to disaster risk, because while they called for it, and it sounded quite innovative and really helpful in the Australian context when we think about people-centered approaches to health and disability services and support, the problem was that there was no suggestion about how to implement those practices. Now, in Australia, at a national level, we have a national strategy for disaster resilience, and we have a framework for disaster risk reduction. Those frameworks really set the tone for how the emergency services arrangements will operate. And they have a really key expectation of us as individuals, the organizations and community services and businesses we interact with, as well as the emergency sector and government. And that is that we'll all take our share of the responsibility when disasters strike, and we will all do what we can to make sure each other is safe in that process. The challenge for emergency personnel, though, is that disability is constantly sitting in that too hard basket under the desk with all these principles and ideas for what should happen, but no real methods, tools, and approaches on how to undertake it. And so if I could have $1 for every time the emergency service and government colleagues have used this term, disability in the too hard basket, I would be very wealthy today. And further, our emergency services and government colleagues say this very common phrase: we know there's a gap. We feel it, we see it, and we hear it when there are response efforts that are gone wrong. And I must say, my heart goes out to our emergency service colleagues and volunteers who are on the front lines of response and recovery, because I don't know how we can expect them to manage that kind of response. And Lismore, I really feel for you in our recent disasters there about how we could possibly respond if we haven't pre-planned and prepared for the extra support needs of so many people in our communities. So our research is really responding to these challenges and issues. We're trying to develop the methods, the tools, the policy guidance, provide the data, the best practice, and the evidence about how do you actually put disability inclusive disaster risk reduction into action. And the main research question is this prickly one: how do we enable people with disability to take control of their own preparedness? That's their share of the responsibility, while also ensuring that their rights to protection and safety are met in a disaster situation. This is really critically important because some people with disability have extra support needs that will surpass their capabilities in a disaster situation, and they have a right to have those needs met. So we put together the knowledge to action process in a number of iterative phases, and I'm going to tell you just a bit more about the person-centered tools that we've developed from that process. And I've highlighted on the screen products and tools, because that is really the focus of our co-production efforts. Multiple stakeholders having a very strong hand in co-designing those tools that they can use to decrease that risk and to increase the inclusion of people with disability. In all of our work, we have 3 groups of stakeholders involved, and by design, it enables the cross-sector collaboration to happen from the very beginning. So we include people with disability, and that includes their allies, it includes carers, and it includes representative organizations that support them. We include community, disability, health, and every possible service you could imagine under the sun that fits any kind of community service that provides support for people with disability. They're invited to the table. And we include local disaster managers. And in that, we include people in council who hold inclusion, access, community engagement functions, as well as the members in councils who hold roles in disaster management or emergency management planning, response, and recovery. And we also include our emergency service colleagues. You can see the SES shirts on some of the folks at the table. And what it looks like in practice is this. It looks like people with disability at the front of the room, leading the conversation and having their voice heard, and having input into how the tools that we develop together look. It looks like the services that supporting them are involved in the conversations and considering what roles they can play in the process, having them think and rethink about their service continuity plans and how their plans intersect with people that they support on a regular basis, including the additional support needs that they might be able to identify in a pre-planning process and respond to when disasters strike. And a good example of that is organizations who run, for example, transportation services and might be able to have access to a fleet of accessible transportation to support people who have trouble evacuating in a disaster. And it also looks like the engagement of emergency personnel working alongside. So I always say in the work that we do, it's really about the working together across sectors. And absolutely, people with disability are a critical and important voice in this process, but so are the other stakeholders. And so the work that we do really must involve all of them working in partnership together. So I just wanted to tell you a little bit about two things that we've developed. One is this disability inclusive disaster risk reduction framework that emerged from a number and a series of community consultations that were inclusive of all of those stakeholders. What was, I think, really useful about that particular tool, and I'd encourage you to go have a look at that and the other video-based resources that have come from our field testing of that toolkit. The reason that toolkit is so critical is that it outlined for the first time those actions that individuals within those sectors could take and how the responsibilities could be shared between those individuals. So it really contributed to understanding how do we define and refine our individual roles and our shared responsibilities to be able to uphold the principles that Australia aims to adhere to and ensure the rights of people with disability in that process. So I'd encourage you to have a look at those resources, and I'll share where you can find them soon. Oh, I guess the other thing I should say about that is we really are hoping that these tools will help businesses, community organizations, governments in particular, and our emergency services to now meet their responsibility under Australia's disability strategy, which includes, for the first time, disability inclusive emergency planning and person-centered plans in the community and their intersection. And because that's now in the strategy, it now requires governments and emergency services to really step up and figure out how to make that happen. I also want to tell you about our person-centered emergency preparedness tool and kind of leave you with that one. In 2017, we had just finished a first large project on disability inclusive disaster risk reduction, where we really had started bringing these actors together to have those hard conversations. That project centered on developing local disaster management guidelines for emergency personnel. And our whole idea behind that was to give that initial direction, these action-oriented nuggets for council emergency services to cooperate more with people with disability and the services that support them. And we had embedded those 4 principles of inclusive disaster risk reduction into and integrated with the findings from that. The problem was we created a problem for the emergency services sector, and we created a problem for ourselves. One of the key recommendations that arose from that was that people with disability needed self-assessment tools where they could assess their preparedness, capabilities, and risks, and actually use a tool to tailor emergency preparedness to their support needs in their situation. And the problem we created was making a recommendations for which no tools actually existed to undertake that in practice. And so we set about to develop that over the ensuing years. Over time, we did this and in partnership with multiple stakeholders, and it has now become a suite of person-centered emergency preparedness resources, not just one tool. The person-centered emergency preparedness toolkit really is about shifting that emphasis from preparedness by people with disability in partnership with emergency personnel, and including and in partnership with the services that support them. And the intent is to respond to that Sendai framework call for people-centered approaches and build the tools that allow people to help that to happen. Now, we have this new national disability insurance quality and safeguarding framework legislative amendment. Service providers in the disability sector providing those services are required now to have disability inclusive emergency plans and service continuity and supports in place. We've created a new challenge for our service providers, and I really feel for them because this is a new and emerging practice. And I can say for sure that our service providers have been as excluded from disaster management planning as the people that they support. And so I think it's really important in the next, probably the next 5 years of our work to really focus on what needs to happen to develop the capacity within the services sector to make sure that they can actually uphold those standards and their obligations to the people that they support. So our research team is really committed and have developed some training and tools to make that happen. So I'll just leave you with some information about the person-centered tool. It's really about matching emergency planning to the support needs people have. What I suppose is most unique about it is our capability wheel, which seems to be the most loved aspect of the PSEP. And I think that's because what it does is it breaks preparedness down into 8 elements. You can go quite deep into those elements in the workbooks and the probing questions and the tips and strategies that come from the lived experience of people with disability. Service providers and emergency personnel do help you dig into those areas. But the most critical thing is that planning starts with how do you manage every day, because people with disability manage in inaccessible environments all of the time. And a disaster situation is just an extreme version of how they put their resilience to action on a regular basis. And so for our emergency personnel who ask me what's new and what's different about PSEP, then all of the community engagement and tools that we use already to help people be aware and prepared for disasters. And I say to them, we add a first step that really has everything to do with how you manage every day before you introduce information about what is your risks and how are you going to tailor that preparedness plan matched to those risks. The other thing that the PSEP gives people permission to do is to consider preparedness as a process, not a one-time event, and to recognize that people with disability in particular, and I would argue all of us, as our support needs and situations change, we need to revisit and revise our plans and our contingencies in those plans. It needs to become embedded and a part of everyday life, and it needs to take an all hazards approach, not just the hazard we think we're going to face, but the surprising one of a global pandemic as well. And of course, the other thing that happens with the person-centered toolkit is it promotes cross-sector collaborative action. When people have the tool and the permission to identify their strengths and support needs as a starting point for preparedness, and then they have permission and accessible tools that they can interact with council and emergency services to now learn about their disaster risks and understand what steps they need to take to prepare for those risks, then they can actually take meaningful action and tailor that plan to what that means for them in their situation. And the other thing I tell my emergency colleagues is that we have a 4th step that doesn't exist in our routine community engagement and emergency management planning practices. And that is, we have to make sure people have communicated that plan with the people that matter. And for people with disability, we need to make sure that we're able to address gaps in plans that keep them at risk in a disaster situation. So that 4th step is a really critical part of the process. And I think that's what's really direly needed, as Jodie said, to make sure that those support needs get embedded into community level disaster management plans and processes. So I'll just leave you with what I think are 3 key learnings from all of this work that we've been doing, building these tools together. The first is that the vulnerability approach does not work. We take disability out of the too hard basket when we approach people with disability as capable, having both rights and responsibilities for their own safety and well-being in emergencies. The tools we use direct how we work. So when we build participation and empowerment processes into tools, we get collaborative action on the other side. And I think these pictures are a good illustration of how that looks when we put those tools into action. And I love the picture of Gary teaching a group of SES about the support needs people with disability have in his community so that they can make better plans. And the third is that true partnership begins with genuine acts of humility. If we want to achieve shared responsibility in disaster risk reduction, we'll need to have humility in spades and an ability to listen and learn together. So we really should all be like Peter and Christy. I'd like to just acknowledge that this is on the slide, the number of and diversity of logos you see are the range of partners, but this is not an exhaustive list, and probably each week more and more collaborators come on board to help put these tools into practice where they live, work, and play. And I promised that I would share where you could find these tools, and it's on our website called DIDR Australia, or Collaborating for Inclusion, which is our handle. And feel free to visit there, where you can learn more about what we have produced and what we have underway into the current and near future. And if anyone would love more information, please don't hesitate to get in contact with me. Thank you.
Thanks, Michelle. That was great. We just thought we've got a little bit of time, so we've got 10 minutes. If anyone's got any questions, feel free to turn your camera on so we're not feeling like we're sort of presenting into some weird vortex. But we welcome any questions you may have or comments. Robin, please.
Hi, can you hear me? Hi, Robin Monk from Clarence Valley Council. I'm just curious, particularly with the Australian warning system being rolled out nationally, what sort of level of consultation was undertaken with people with disabilities in the development of that? Because I note that you said earlier on in your presentation, Jodie, that you know, some people with disabilities are struggling or maybe struggling with understanding the impacts of the warning systems that are currently available.
I can respond to that one if you'd like, Jodie. Your question is incredibly timely, Robin. As we know, the Australian warning system is being rolled out, and in different jurisdictions, it's happening at different times and in different timeframes. Literally in the last month, particularly the Queensland Local Government Association and QFES, who's charged with developing the rollout of the Australian warning system in Queensland, came to our team to say, we're just starting this process of creating the communications around this. And one of the local government association folks who've been a key part on this journey of disability inclusive disaster risk reduction in Queensland, she said, wait a minute, this isn't right. I don't see anyone around the table with a disability. We need a voice in here. And she made the very strong call to the committee to say, I don't think we want to be rewriting this. I think we want to get it right from the beginning. So actually we've involved Queenslanders with Disability Network and their advocates. And as I understand it, just last week, they've hired some of their disability advocates to participate on the committee. So they'll be remunerated for their participation. And on my team, we have a language and translation expert, and she's going to support the process from a research perspective because she can do assessments of the readability of the outputs of those warnings. So it's quite an exciting example. I said to them the other day that this is how DIDR works. You start where you are, you recognize where the gaps are, and you get the right people around the table. So yeah, thank you for that question, Robin.
Adam? You got your hand up.
G'day, I'm a health promotion officer in northern New South Wales and have lived experience of the floods, but not of disability. And I guess with the off the back of that, the flood report and the government's response, how do we kind of get disability really, and the most vulnerable people prioritised when you're looking at a flood response where you've got sort of a Northern Rivers Reconstruction Corporation with an advisory board that doesn't apparently, have great representation of disability, lived experience disability. You've got to move towards a New South Wales Reconstruction Authority, which the Reconstruction Corporation will come, and you've got a Deputy Commissioner of Police to kind of take on the role of combat response in floods. How do we get disability into the room and being really prioritised in these people's minds when they're kind of doing the, the command and control sort of emergency response style.
Thanks, Adam. Look, I'll make a start, but I'm sure Michelle can contribute. For me, I in response to that, it's really about working with local and peak advocacy organisations, so that there are disability advocacy and peak organisations around, and so really ensuring that they are at the table in these conversations. So that to me would be one way. Michelle, did you have anything to add to that?
Yeah, thanks, Adam. Those are incredible observations. And I might add to those observations that what's probably missing at the local council level before a disaster happens is people with disability and their representative organizations are not necessarily an active part of the community interagency groups, and the council interagency groups are disability interagencies. And I think that can be part of our biggest problem. I think governments, and I say this a lot to government stakeholders, they might be getting sick of me saying it, but I always tell them that the biggest mistake you typically make is assuming that a service provider around the table speaks for people with disability and carers. They do not. You need to make sure that people with disability are around the table and carers and their representative organizations. And when you do that, you need to make sure that you get a wide range of representative voice around the table, not just the same squeaky wheel or the same person that you feel comfortable having around the table or consulting with. There needs to be a diversity of support needs. One thing that's been really great about the PSEP tool is helping council and emergency services go, oh, when you say we need people with a wide range of different support needs, we need to look around that capability wheel, and we need to find people who use personal support and technology and have an assistance animal and who have challenges with their living situation or who are homeless. And we can actually now go around that wheel to think about what representation truly means. We're working right now with Red Cross, their community action teams, or whatever they're called in different communities, as well as the recovery support officers and councils, to look at how can they embed that pre-planning really early on in the communities. And a big part of my current research program is actually about looking at the support coordination and leadership roles of local councils. It's easier in some states than it is in others because the emergency management arrangements are slightly different from one jurisdiction to the next, and I recognize that. But I think ultimately there's a lot of power in the potential of councils and their connections to community to play a really important role in this space, and be given the resources and the opportunity to take that on too.
Thank you.
Thank you, Carrie. CRT, Community Resilience Team. That's what I meant.
Are there any other comments or questions? Okay then. Well, thank you, everyone. Thank you, Michelle. Thank you, everyone, for coming, and for Megan for introducing us. And just, again, this is such an important piece of work, and it's been really great to be able to have the research that's been done by the UCRH in 2017 to inform, hopefully, the recovery efforts for the 2022 floods. So thank you, and thanks, Michelle, for your time and your input.
And thanks. I'd like to say thank you to both Jodie and Michelle for a really, it's a rallying call. This sort of presentation is the kind of presentation that really outlines where the problems are, but also, some solutions, some ways forward, and inspires us all, I think, to take those next steps. So thank you both for a really good presentation.
Pleasure.
Thanks, everyone.
And thanks.
Feel free to get in touch.
Michelle, Robert Monk again, just one last thing before you go. I'm really interested to speak with this local emergency management officer who you were discussing earlier, because as myself, in my role as a local emergency management officer for Clarence Valley, I'm working on some education pieces that I'm looking at integrating, and I've certainly reached out to Pravathi in regards to the PSEP piece that's going on at the moment as well. But I'm just really keen from an emergency management perspective to speak to someone who's been involved at that level. I was just wondering if it's possible for you to connect me with them.
I can absolutely do that, and with others, Robin, but also I can do even one better, and perhaps we can chat about getting involved in a disability inclusive emergency planning event in your council area, which is part of our remit in the Leave Nobody Behind project. So I would love to chat about how we might bring that to your community.
Yeah, because we've had a real, I don't know, I say this, we've had a lot going on, but this is even outside sort of the flood stuff. We've actually had some, stuff come together around evacuation centres and the like as well. So there's a whole area of work that I'm really keen on getting involved with, and looking at how we can work that to fit some of the challenges that we're facing in our area, particularly in light of what happened, in our backyard very recently.
Oh, these emergency planning forums, I think, are the right fit. Obviously, in addition to our PSEP short course, so I'm glad you've been in touch about that too.
Yep.
But I've just left my email in there.
Thank
Do you
you.
want to email me and we can?
Yeah,
can follow
that would be
up
lovely.
the
Thank you so much.
That sounds great. Thanks, Robin.
Okay, thank you.
Well, thank you again, everyone, and I'll finish up now. Be in touch.
Thanks, Jodie, for inviting me and including me.
Thanks, everyone.